There are three common ones. The most common is underneath the breast, we call the inframammary incision. The second most common is along the edge of the areola, and then the third would be the armpit. All three are good. All three have advantages and disadvantages. By and large, I do favor the underneath the breast incision. A couple of reasons. Number one, it's a really well hidden incision for the vast majority of people. Once that scar fades, it's usually no more than about 1.5 inches long, and it's going to hide right in the crease of the breast. Number two, I really like that incision because it has the lowest risk of developing abnormally tight scar tissue called a capsular contracture. And number three, we know that at some point in the future, people are going to have a revision surgery. This is not a lifelong operation, and that approach allows me to do any revision that I need to do. So therefore, you're always going to have something to work from. As far as the disadvantages of that incision, once in a while it may slide out of the crease, and when that happens, it usually slides up a little bit, which is actually better than sliding down because it's still hidden by a bikini. Number two, if somebody really wants a scarless breast, that's not going to be a good incision. And number three, if someone does tend to heal with a dark scar or they have scar healing problems, that scar is going to potentially be a little bit more noticeable. The Arilla incision is probably the best hidden out of any incision. Unless someone has a really, really tiny Arilla, you've got a pretty good color difference in most women, so you have a natural shadow that you can hide in. But the downside to that incision is it has the highest risk of developing that capsular contracture. It's about 6 times as high as underneath the breast. And so when it goes well, it's an amazing incision. I love it. When it doesn't go well, it can create problems that I've actually seen people who've had problems that are hard to fix. So I really steer away from that one nowadays. And then the armpit incision is probably my second favorite. It's great if you want a scarless breast because the scar is hidden in the armpit. It's usually really well camouflaged, and unless I guess you're a professional volleyball player, it's really not going to be much of an issue. It also heals really, really nicely. The downside to that incision is it's a little bit more challenging with really big implants, although we can still do it. And number two, there are limitations as to what types of revisions we can do through that incision. So depending on what happens down the road, we may have to bring in a second incision set to accomplish revision goals.